So the Minded Institute is like a mini university, essentially, for people that want to use therapeutic yoga, or what we call yoga therapy, to work with non-communicable diseases. That's essentially everything that's lifestyle related and non-infectious. And it's a training institution that's very much vouched in the overlap between science and spirituality. Namaste, and good morning, everyone. We have an internationally renowned diploma in yoga therapy. It is the equivalent of doing a master's degree. It's not actually a master's degree, but it is the equivalent of in terms of workload and what you learn. So the course is for yoga professionals and for health professionals. And in terms of health professionals, it's really a wide list. Nurses, doctors, physios, psychologists, psychotherapists, social workers, allied health professionals. So the course is actually a rich medley of all of these different people and perspectives coming together to learn how to use therapeutic yoga.
And so I did my original 200-hour yoga teacher training and just felt like I wanted a little bit more. I wanted to continue my studies, and yoga therapy for me felt like this scientific, in detail study of yoga.
So I wanted to become a yoga therapist, essentially to give the clients some empowerment over their things that were affecting their lives day to day. I wanted to empower people rather than fix them.
Talking therapy has its limits, and I want to support my patients even more. And sometimes, you know, the body holds certain patterns and emotions, and it's kind of easier to access than just by cognitive therapies.
For me, the sort of crucial difference is that Western medicine and Western healthcare is geared towards treating illness. And with yoga therapy, we work to restore health, and there's a fundamental difference in the starting point, which I think makes all the difference in recovery.
Yoga therapy is really pioneering work, and I think training with Minded, you really feel like you're on the front line of that.
So the 580-hour course, and there are add-ons, is divided into 15 modules. 8 of those are in person, 7 of those are online, and they take place from Thursday to Sunday. And during that time, there's lecture, there's partner work, there's self-reflection, there's journaling, and there's, of course, yoga practice. We cover so many different topics. We cover clinical skills, we cover anatomy, we cover physiology, we cover mental and physical health conditions, musculoskeletal conditions, breathing practices, philosophy, nutrition. It's a really well-rounded amount of material.
I've loved the academic side of it. It's the way my brain traditionally functions, but the course has been a real melting pot of the academic from the bodily experiential point, and it's brought in the philosophical aspects of the work that we do. So it really is the way we've learned is the way we work.
It has loads of anatomical knowledge, and the physiology of our bodies is just
The course has been great. So it's been really intense at times. There's been so much more depth to the knowledge than I expected in some ways, and I've really enjoyed the balance between the physical side, the philosophy, the psychology, the clinical skills that I've developed as well on this course has been wonderful.
There's also so much heart, there's Buddhist philosophy, yogic philosophy, and psychotherapeutic skills, how to look and meet people with soft eyes and an open-heartedness, which has been amazing.
And then with that breath in, we bring this environment in. From the groundness of the skeletal system to the fluid body that flows through us. So in my classes, there is case studies. I use a lot of my background. So I bring to the table what I do, because I am a practicing clinician. I work in chronic pain, I work in orthopedics, I am a yoga therapist, I'm a Pilates teacher. So I bring real cases to the table. In spinal curls, but not pain in forward bend, and kind of taking the hips away a little bit. Classes are very practical, and people get a chance in that moment to practice, and then being able to step, hopefully to step with confidence out of this room and bring it in life, and bring it to the house, and bring it to the clinics.
We have 5 primary lecturers, all who are renowned in their own fields, as well as yoga therapists. We have lots of international guest lecturers, also world leaders often in their fields.
So people simultaneously want to care but then reject it or push it away. I'm Dr. Lindsay Jones. I'm a consultant psychologist working in Exeter in Devon in the NHS. I mean, yoga therapy is absolutely fantastic. It's very holistic. It's building on sort of knowledge of the person across many different domains, across the biological, across the psychological. It incorporates yoga philosophy, it incorporates understanding of the body and mind and the interactions between them. So it really is on the cutting edge. Difficulties developing relationships, they can also be sort of healed in relationships. I would definitely recommend the yoga therapy diploma, and I have recommended it to many of my colleagues. Because I think it does add that extra sort of layer of skills that we often aren't necessarily taught in standard mental health trainings. So I would definitely recommend it. It's really added richness to the work that I do and helps me personally as well to regulate my own feelings and emotions and do the work successfully.
I've been hugely impressed by the by the quality of the teaching, the level of engagement, the level of support. It's a very intense course that requires a lot of you when you're here and in between, but I think you are well supported within that.
The teachers are incredible. I feel very privileged to have learnt from them in such an embodied, meaningful way.
There is such a diverse range of lecturers on this course, and they are world leaders in their field. So some of the lectures have been really exciting to get that contact time with those people.
They've all written their section of the manual, and I know I have a fantastic resource now to go back to if ever I need to, if I'm working with a client with a particular condition. So yeah, their teaching's amazing, plus what they've provided in terms of a manual has been amazing as well.
And often it was more challenging, so it made me think, this is where we need to be looking at the posture, because she's needing to work a bit harder.
So all students receive supervision, and supervision is a core element of the course, and students constantly report how important it is for their growth. I think that's a really meaningful relationship.
And for me as a trainee yoga therapist, to kind of explore this with her, so there were kind of some little light bulb moments for her throughout the practice.
Supervision is really important because it allows us the opportunity to gain experience through transmission, right? Because we can do this work on our own, right? We can go out and do our thing. But when we can interact with another person who's kind of had maybe more life experience around these concepts, it can be very powerful, and it can kind of excel our understanding.
Supervision is fundamental to both students and therapists' learning and growth and capacity to hold their clients. So it gives students and therapists space to think about the client and what they bring to the session and how they impact the client.
So there's a faculty of like 40 people, I want to say, give or take. And so we're all working really hard to make sure that people feel comfortable, right? This sense of having support is really important.
Our students do so many different things when they graduate. So first of all, the health professionals often bring the work back into their given health profession, or they might leave their health profession and go to be a full-time yoga therapist, or have a hybrid of both. And our yoga teachers often will do work in private practice, work in the NHS, often join other courses because they're very pioneering and always wanting to learn and create their own trainings.
I am a practicing yoga therapist now within the prison systems. So it's allowed me the opportunity to work directly one-to-one with clients and to have the support of the mental health team within those institutions, which is really nice. So it's kind of shifted the whole dynamic of what I do now. Yeah, no longer just in the gym.
I work as a psychotherapist, but I do incorporate yoga therapy into my work, but I do also have clients that just come to me for yoga therapy.
My experience of our graduates is they do what they set out to do, and that is in part because we armor them with so much knowledge, and the kind of people that do this training, they're pioneering in the first place. That's who we take, the change makers.
My future feels great in terms of yoga therapy and professionally. I'd really like to take a lot of the learnings I've had from my yoga therapy training and teach courses for anxiety, courses for depression, yoga courses for maybe people who have sleep troubles. So yeah, I feel like for me a real focus is going to be on teaching yoga in a therapeutic way to groups.
I'm so excited about the future. I feel like it is the future. I feel like it's the way forward, like really looking at the whole person and everything around that mind-body connection and really feeling instead of thinking your way through life.
I feel I have the skills and training to start learning and working in a way that really speaks to me. So I feel like sort of the light is shining on my path now, and I know what it is. Yeah.
Meeting, being part of this group of like-minded people, you know, like-minded, like we like-minded. It's very empowering. It's reassuring that it's the way to go, that we'll each find our ways of practicing these amazing tools.
So even though the course hasn't finished yet, I feel like after every module I've been taking in those skills and bringing them out to my clients, and it's been sort of building on it bit by bit.
This training has been life-changing for me, not only in terms of personal transformation, but the opportunities that it has provided. It's opened doors already, and I haven't even graduated yet.
You know, I think running this institute has been my life's work, and it's been an honor, and it's been really amazing to see the seed that I planted be taken up by so many people, and to watch now hundreds of our graduates make significant changes in society. I'll go onto the internet and look up a particular area, and one of my students is leading on that, and that's really amazing. It's really wonderful to be part of the Minded Institute as opposed to just the creator of it, part of this movement.